that I want to do is get actually 2 pieces of tape. I try to tear it in half, but I know if I attempt to tear it in half, this is not like the thick that you could tear in half, okay? Oh, okay, better. Got my tape ready. I'm gonna use the glove that's in here. Do not use iodine on the mannequins. Take it out, okay? Take the iodine out of your package, okay?
Well, that'll probably stain that material right up real good.
Yeah, it will. Take out your label, and I will fill my label out with the needle gauge size that I'm going to use, which is going to be a 20. The date. Your peripheral IVs are only good for 3 days or 72 hours.
In the hospital now, they don't do that anymore.
Okay.
They allow it to go as long as
It possibly can because it's an issue.
Unless they try to do it the least invasive.
Right.
What does the clinic do?
Every 5.
Every 5 days?
Really?
It's either-
Okay.
It's every 5, or if there's like obvious signs of infection or contraindicating signs.
Yeah. They try to let
Okay.
it go as long as possible.
So we're going, I know I'm going to be IV pushing my LASIK, so I am going to get my needle and I'm going to draw up whatever my order tells me to draw up. And it's probably a very small dose. This is a new bottle. I didn't need to have to clean it off.
Would you have done that?
You're not going to use the needle for the IV.
Oh, okay.
But it's just gonna make it stay
I get it.
aseptic, sterile,
Sure.
okay? Now I am going to take my extension tubing. I need to check to make sure that it is patent. And I'm going to use aseptic technique for that as well. I'm going to take this little piece off. And you'll see why I did that in a minute. Take it on, screw this on. Flush a little bit. Okay, that's ready to go. I look at my patient's skin, I assess the skin area. You do not place IVs in patients who have had a mastectomy. Patient with grafts, you do not use the arms with grafts. Also, fistulas.
Well, now, so why don't you do the, so say if they have a mastectomy, why don't you use that side? I did hear that before. I just don't know.
No lymph nodes.
Cool. I get it.
So they'll get lymphedema?
They can.
They can from the fluid.
Okay.
So we don't use those.
Cool.
Okay. So wash my hands. This is not a sterile procedure. It's usually clean. However, since I had to use, I'm using these gloves, which I hate. And don't wear chunky rings. Okay? Don't wear chunky rings. Okay? So I put my tourniquet on 2 to 3 inches above the site that I'm going to utilize. And when you
Freshness. It's always priority.
Love it mentally.
Here's one.
We can
Trying to
pretend
get
that we
broke.
kind of.
Okay, I got the dark card.
Okay. Let's see. Oh, that's dry rotted.
I have a bunch of them just in
I'm wondering if they,
the
I hope they not dry rotted like that.
No, they're not.
Okay.
Yeah, one.
Yeah, I got one. So take your tourniquet and make it tight as you can. Okay? So I got my tourniquet on. Take it, and I think I am going to use we'll try for this cephalic here, okay? Clean my side off. Clean, 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 clean. Please make sure your site is dry. Don't blow on your site after you clean it.
Or lose the arm.
Documented as non-compliant.
Okay? When you go in, there is a little piece on your angio-calf. You see this little pink piece? Take your finger and hold it. Otherwise, the tip of the calf is going to roll.
I get it.
Okay, so I got this held. Make sure the bevel of the needle is up.
We'll put it.
I'm looking for a flash or a return, which I would normally get. Once I get in, I pop. I'm going to slide this off. I'm sliding this off. Okay. I am going to hold it. I am going to pop it. I am going to take this, my extension tubing, and I am going to connect. Once I am connected, I'm still holding. I'm still holding. I pull back. I push in.
You do the same.
This is called a chevron technique, and you probably will not utilize this. They don't do the chevron anymore. Okay, chevron is when you actually take the tape. If I can get it underneath.
That's sticky side up or down?
Up. The sticky side is up.
This tape is
See, that's the old school way, and it doesn't move.
This is the old school way of doing it. Take it, go across, crisscross it.
Oh, I see. I get it.
Get it?
That makes sense.
I do not want, I'm good right here. Good right here.
So at this point, you can let go.
At this point, you can let go. Take your tegaderm. Hold on. It's the dumbness. Can't stand this tegaderm. Put it on. Clamp this off. Clamp this off. I left this connected for a reason. Make sure this clamped off, because if you don't, what you're gonna see? Look, come back. Yep, it's gonna be all backed up. Okay, it's going to be all backed up. So I clamped that off. And what I do? Oh, okay. I'm not gonna lay this down. I'm gonna keep that in my hand. Okay. Screw, unclamp, push a little bit. Okay, because you give morphine over 5 minutes. Push a little bit. Push a little bit. Push a little bit. Never IV push any medication fast. Ever, 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 ever. Okay? Okay. So, I need to switch this out. Flush it over the same amount of time. A little bit at a 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 time.
So the rate you just pushed, is that a true rate? Or
Yeah,
would you
that is
actually
a
be
true
waiting on
rate.
it?
That's a true rate.
Okay.
That's in the drug book. Okay. Take it. This is labeled. I got it clamped back off.
And then you bring it.
And then you,
It'd be rolled on before the end. Another piece of tape, please. Thank you. And to keep your IV from flapping all over the place, take it and stabilize. Okay? Do not do your chevron over your actual site of insertion. You cannot see, you will not be able to see this, the actual calf part. You want to be able to see it because you need to assess if that IV will be infiltrated, okay?
so when we do the chevron, we're going around the plastic here or the hose in front
So
of
you
it?
going around this pink part.
The pink, okay.
The pink part, okay? This part.
Gotcha.
But not over that actual catheter. You understand? Okay?